Bismillah ar-Rahman ar-Rahim. Our lecture today about the rheumatic disease. The definition of rheumatic disease: an inflammatory disease involving the connective tissue of the whole body. Etiology of the rheumatic disease: multifactorial, inherited factor زائدا environmental factor. Clinical manifestation of rheumatic disease in general: fever, anorexia, fatigue, weight loss. Cutaneous manifestation as skin rash, subcutaneous nodule, erythropathy, joint pain, stiffness, joint swelling, redness, hotness, pain, tenderness with limitation of the movement. Myositis, tenosynovitis, systemic manifestation, polycirrhosis, lymph node enlargement, hepatosplenomegaly, respiratory system, as pneumonitis may be presented with cough, respiratory distress with wheezy chest. Pleural effusion, cardiovascular, may be presented with pancreatitis, coronary vasculitis. Both cardiomegaly may be presented with heart failure. CNS may be seizure, stroke, personality changes, peripheral neuropathy. GIT of rheumatic disease may be presented with abdominal pain, vomiting, diarrhea, intestinal infarction. Renal, most serious complication in rheumatic disease, may be presented with glomerulonephritis, as hematuria, proteinuria, impaired of the renal function, may be presented with hypertension. Hematological may be presented with pancytopenia, pallor, bleeding tendency, infection. Ocular, iridocyclitis, retinal hemorrhage. Investigation in general rheumatic disease may as acute phase reaction من هنا for prognosis. ESR C-reactive protein. Rheumatoid factor. شنو definition of rheumatoid factor؟ هو antibodies reacting with FC portion of the IgG. وين نشوف rheumatoid factor positive؟ which disease؟ rheumatoid arthritis ممكن نشوفها بالأسئلة، scleroderma, chronic active hepatitis, infection like viral Epstein virus, parasite, malignancy as leukemia, lymphoma. Anti-nuclear antibody هو الانتيبودي against the nuclear component DNA والRNA. Positive وين نشوف positive anti-nuclear antibody بالأسئلة scleroderma, rheumatoid arthritis, chronic active hepatitis, infection as viral Epstein virus, malignancy as leukemia, lymphoma. LE phenomena or LE cell complement, total complement hemolytic activity or serum complement of C3 or C4, serum immunoglobulin level, HLA system, immune complex determination, others, or biochemistry, urinalysis, CSF, X-ray, cardiac evaluation, echo, ECG, ultrasound, slit lamp, or fundoscopy. نيجي على الموست كمان هو rheumatic disease هو juvenile rheumatoid arthritis. Definition of juvenile rheumatoid arthritis هي chronic synovitis with extra-articular manifestation. Etiology as I mentioned before. The onset of rheumatoid arthritis اللي هي onset after second year of life. Clinical onset may be presented with joint, may be precipitated by joint trauma, systemic infection, psychological stress. Pathology: articular, joint effusion, thickening, projection of synovial membrane, erosion, articular cartilage, bone erosion below the cartilage, and osteoporosis, tenosynovitis, myositis, subcutaneous skin nodule, or extra-articular, chronic inflammatory cell infiltration surrounding fibrinoid material. Clinical manifestation may be as polyarticular type or pauciarticular. Polyarticular, more than 4 joints affected, may be rheumatoid factor positive or rheumatoid factor negative. Positive anti-nuclear antibody positive in 75% of chronic, may be presented with a chronic severe arthritis in 50% of the cases as sacroiliitis. Rheumatoid factor negative, anti-nuclear antibody positive in 25%, chronic severe arthritis in 10% of the cases, iridocyclitis. Erythropathy, insidious onset, symmetrical arthritis affected multiple joint, mainly the small joint of the hand and cervical spine. Affected joints are red, swollen, hot, limitation of movement. Fusiform finger are characteristic. Skin rash, rheumatoid nodules. Extra-articular, mild systemic manifestation اللي هي fever, lymphadenopathy, hepatosplenomegaly, mild anemia. الباوسي articular, oligo-articular, أقل من 4 joint, it may be type 1 or type 2. Early onset, anti-nuclear antibody positive in 90% presented with iridocyclitis. Late onset sacroiliitis, iridocyclitis. Erythropathy, asymmetrical arthritis, affected large joint, knee joint, ankle joint. Affected joint is swollen. Axial polyarticular, affected small joint, presented as symmetrical, both of the limb affected. Skin manifestation, as I mentioned before, systemic onset started with systemic manifestation, polyarticular with a few months. Prognosis of the rheumatoid arthritis, chronic joint disease, may be present with exacerbation and remission, maybe lead to the joint deformity. Investigation, as I mentioned before, in addition to the assess the synovial fluid examination. شو نشوف synovial fluid examination? The protein is high, cell increase, decrease of glucose. X-ray of the joint, early osteoporosis, soft tissue swelling, late narrow joint pains, joint destruction, joint effusion, slit lamp. Diagnosis of rheumatoid arthritis, clinical erythropathy, systemic manifestation, more than 3 months after exclusion of other disease. Treatment, anti-inflammatory drug, non-steroidal anti-inflammatory drug for months or years. Hydroxychloroquine, sulfasalazine. Third, corticosteroid. In severe cases, not responding to the salicylate or immune suppressive drug like methotrexate, azathioprine, biological drug, physiotherapy, diet. Second disease of rheumatic disease هو الأسألي, systemic lupus erythematosus. الonset after over 8 years. Female to male ratio 8:1. Etiology unknown, maybe autoimmune disease. Antibodies against nuclear part or immunoglobulin against RBC, white BC, platelet coagulation factor. Immune complex complement deposition lead to the tissue damage. Clinical manifestation of SLE, cutaneous manifestation, butterfly rash, malar rash, erythematous, scaly or bullous lesion, macular punctate lesion of the palm and soles, oral mucosal ulcer, alopecia, photosensitivity. Investigation of SLE نبدي بالسمبل هي الكومبليت بلاد بيكتشر. شو نشوف may be present with pancytopenia, acute face reaction اللي هي فيدنا بالبروجنوسيس اللي هي ESR, C-reactive protein. Anti-nuclear antibody present in all cases with active SLE. Double-strand DNA is for diagnostic, hypocomplementemia, genuine renal function, ultrasound, renal biopsy. Diagnosis of SLE, 4 or more of the following criteria should be present. بالسكن شنشوف manifestation بالSLE, malar rash, discoid erythematous rash, photosensitivity, mucosal oral ulcer, joint arthritis, polypsoriasis. Systemic renal lupus nephritis, hematological hemolytic uremic syndrome or hemolytic anemia, pancytopenia, neurological convulsion, psychosis, immunological, antinuclear antibody, double-strand DNA. Treatment of SLE. The aim of the treatment, suppression of the inflammation and the prevention of immune complex deposition, mild case with no nephritis, salicylate, and non-steroidal anti-inflammatory. Facial rash, chloroquine. A prognosis of SLE. Potentially fatal disease affected the renal system, cardiac system. 5-year survival rate is 90% with proper treatment, frequent evaluation of the patient. Neonatal lupus etiology, it results from maternal transfer of immunoglobulin G between 12 and 16 weeks of gestation. But however, only a small percentage of offspring will develop this disease. Main clinical manifestation of neonatal lupus هو congenital heart block. Congenital heart block is the main manifestation of the neonatal lupus. In addition to the hepatitis, thrombocytopenia, neutropenia, pulmonary, neurological disease. Cutaneous lesion usually occur after ultraviolet exposure at about 6 weeks of life and last 3 to 4 months. The rash most frequently occur on the face and the scalp, and 25 of the rash leave a scar. Treatment of the lupus, neonatal lupus, mainly supportive treatment in addition to fluorinated corticosteroid, intravenous immunoglobulin, plasmapheresis, hydroxychloroquine, and cardiac pacemaker in patient with congenital heart block. Vasculitis syndrome definition: inflammation of the blood vessels of unknown etiology. It may affect small vessels, like example على small vessels Henoch-Schönlein purpura, medium-sized arteries, Kawasaki polyarteritis nodosa, large vessels, Takayasu arteritis. The most common vasculitis is the Henoch-Schönlein purpura. Etiology is unknown, maybe due to allergy to the drug or maybe follow-up of upper respiratory infection. The pathology of Henoch-Schönlein purpura: inflammatory cells surrounding small blood vessels of the skin with deposition of IgA antibody in the dermis. Clinical manifestation of Henoch-Schönlein purpura: onset at any age, but mainly at between 2 to 8 years of life. Skin manifestation is 100%. Main skin manifestation هو erythematous, raised macules, and papule purpura. Distribution of this rash in the buttock, thigh, trunk, and maybe upper limb. Arthritis, 2/3 of the cases affected large joint, complete resolution with no residuals. Renal involvement, 50% of the cases have renal involvement. Manifestation of renal involvement: hematuria, proteinuria, hypertension, acute renal failure. Recovery is the rule. Few cases may have persistent urinary sediment for years and rarely chronic renal failure. GIT, manifestation of GIT: abdominal colic, vomiting, hematemesis, blood in the stool may lead to the intussusception and intestinal obstruction. CNS manifestation: convulsion, weakness, and coma. Others: lymph node enlargement, hepatosplenomegaly. Investigation: no specific test, complete blood picture, acute face reaction, ESR, C-reactive protein, jelly urine. ممكن تشوف انت هيماتوريا، بروتينيوريا، RBC كاست. renal function test, stool analysis, abdominal ultrasound. Prognosis, mild case, complete cure within a few days. Moderate and severe cases may persist for long course and frequent remission and exacerbation. Diagnosis, skin rash, erythropathy, renal affection, GIT. Treatment, supportive treatment. In symptomatic patient, salicylate, non-steroidal anti-inflammatory drug. In severe cases, prednisolone, 1 to 2 milligram per kg for renal GIT manifestation or CNS manifestation. Management of acute renal failure. Other type of disease of vasculitis, Kawasaki disease. Etiology unknown, may be viral. Clinical manifestation, age of the first 5 years of life. 4 of the following: bilateral, non-purulent conjunctivitis, or oropharyngeal mucus, oropharyngeal mucosa. Manifestation, red, dry, fissure lips, strawberry tongue, pharyngeal congestion, skin rash, generalized erythematous maculopapular rash, extremities, hand or feet, شكون other manifestation, edema, erythema in the palm and sole, and peeling of the tip of the finger and toes. Lymph node enlargement, cervical, usually non-suppurative and non-tender, rarely generalized. Rare manifestation, cough, diarrhea, hepatosplenomegaly, erythropathy. Complication, 20 to 40% have complication. Main complication بالكواساكي disease هو coronary vasculitis اللي هي manifested of as aneurysm, ischemia, myocardial infarction, pericarditis, endocarditis. Investigation, acute phase reaction اللي هو ESR, C-reactive protein, complete blood picture, anemia, leukocytosis, thrombocytosis, cardiac evaluation, chest X-ray, echo, ECG. Differential diagnosis of Kawasaki disease, scarlet fever, staphylococcal, toxic shock syndrome, measles, Epstein-Barr virus, juvenile rheumatoid arthritis. Treatment of Kawasaki disease, intravenous immunoglobulin. If patient have coronary vasculitis, salicylate 100 milligram per kg per day during febrile phase. Thrombolysis, coronary thrombosis by streptokinase, coronary bypass in severe cases. A prognosis, complete recovery for patient without coronary vasculitis. Thank you.